So the palpations of the knee, there's less because we're not going to get too involved as far as like palpating cartilage or ACL, PCL, because you can't really get there because they're deep in the joint. There's a good model here that I'll pass this around, that shows the ligaments as well as the cartilage, the patellar tendon of the knee. If you peel it back, you can see kind of where the ACL and the PCL are, and it's a good idea to look at that just to get a visual, because again, they cross like an X within the joint, so they're deep in there. So we're going to do tests that stretch the ACL, but we can't really touch it, right? It's deep in the joint. So the palpations that you will be responsible for are listed there. So patella is your kneecap, right? And everybody should kind of have an idea. You probably played with your own, but it moves around, right? You can kind of move it side to side, up and down, and that's this free-floating bone of your knee, okay? Fibular head. Is the fibula lateral or medial on the leg? Lateral. So it's on the outside. It's going to be near the knee, but it's on the lateral side, distal to the patella, so lower than the patella. And it's a little bone that sticks out. It's shown here on this model. This is your fibular head. But there's a little bump that sticks out on the outside part of your knee. And that is where one of your ligaments attach. The fibula is non-weight bearing, but a lot of muscles attach here as well. We won't get into which specific ones, but the rounded end on the outside top part of your knee, I guess if you're taking notes, okay? Tibial tuberosity. You can tell in its name it's going to be on the tibia. It is on the anterior part of the tibia. If you walk your thumb down from the bottom part of their kneecap and you kind of you'll feel a bump in the middle. Sometimes it's bigger in certain people, especially in boys. If they had a condition called Osgood-Schlatters, we talked about when they're younger, and their patellar tendon, which is your quad muscle, it attaches here. If it pulls and pulls and pulls, eventually it's going to make that part of the bone bigger. But you can feel it even when you go side to side. You'll kind of go over like a bony projection right there. So even if you go down, you can feel it, and then even side to side, you'll feel it sticking out, okay? The middle part of the knee under the kneecap, tibial tuberosity, okay? MCL and LCL, as long as you're in the general vicinity, there's nothing that's going to tell you you're exactly on it. You can feel the lateral one better. But even on this model, right, when we're looking at this knee, we can tell that the lateral side is always going to be on the fibula side, right? So the smaller bone, and that's this ligament here, it's detached. The MCL is seen on this side here. So the medial part of the knee, midway from the patella to the back, is where the MCL is, okay? Medial side of the knee, halfway between the front and the back of the knee, is where that ligament's going to be. And even when you roll over, the MCL is pretty flat, so you're not going to feel anything necessarily, okay? So just knowing kind of the general vicinity of where it is, you're obviously not going to see anything, right? It's under the skin, just like all of these other palpations. But that's where the MCL is located. And then the opposite side is the LCL. Same thing, other side. So lateral side. And even if you're palpating and you get LCL and it attaches to the fibular head, you want to feel where the fibular head is and then work up a little bit, just up in a straight line, you're guaranteed to be on it, okay? Because it's a straight line, the collateral ligaments mean on the side of, so they're on the side of the knee. And if you're feeling the fibula head and you just go superior or upward, halfway between, again, the front and back of the knee, you'll find their LCL, okay? So they're a lot bigger than the ankle ligament, so I'm not going to draw them on Yuki. But you can get a good idea of what they look like if you guys want to look at the model for the different ligaments. Hamstring versus quadricep. So quad is the front, hamstring is the back of the thigh, right? I gave you guys kind of a gimme, but quadricep muscle, as long as you palpate anywhere on the front of their thigh, so that's going to be superior to their knee joint, you will be on a quadricep muscle, okay? So that one's pretty easy. I mean, even if you're out here, in here, that's quad, because there's 4 muscles, right? There's 3 across, and then 1 on top in the middle. So that's your 4 quads. So hamstrings are in the back, the posterior part of the thigh. And then I want you guys to be able to palpate their tendons. So if you slightly bend, and I was telling you guys before how on the medial side, if you roll over these two bands, you're going to feel 2 on the medial side, 1 on the lateral side. That's your 3 hamstring tendons, okay? I'm not going to bog you down with the name of the exact muscles, but yeah, there's 2 that you'll feel, just the back of the knee, okay? You'll feel those. We're not in the middle, but on that side. Those are super easy enough too, okay? So hamstring, quad, and then IT band. I talked about at the hip a muscle called the tensor fasciae latae, and that is prominently, the belly of the muscle is up here at the hip, but the tendon comes all the way down and attaches at the knee. Sometimes if someone's having lateral knee pain, a lot of times that'll be the responsible structure. It's fascia, just like the fascia on the bottom of your foot. And if you are it's on the lateral side of the knee, a little bit higher than the LCL, but you will roll over. It's a thick band that you're going to roll right over, okay? We're not talking, don't get confused that with the hamstring. That's in the back. But if you feel the hamstrings here, and then you roll a little bit more forward, you're going to feel the IT band. Sometimes it's easier to feel it in a little bit of a bent position. But that's lateral, superior to the patella, right? Higher than the patella. And that's your IT band. That comes across and inserts in the fibular head as well. So you'll get a chance to, I know you guys are feeling around yourselves, but I definitely advise practicing on someone else and just feeling around, digging in, right? A little bit of pressure. It shouldn't be painful on anyone. But again, knowing the anatomy, especially those specific ones, just because muscles attach, tendons attach, ligaments attach, especially to the bony prominences that I told you guys is where sometimes your athletes are going to have their pain, but just knowing what structures are where. If they say my knee hurts right here, you're already going to be thinking MCL, right? But you still have to go through your evaluation process with your palpations and eventually to your special tests to make sure specific structures that are involved. Okay? Anyone have questions on that?